Hi, my name's Hazel. I'm your student nurse today. How are you doing?
Good.
Good. Can you just tell me your name and date of birth?
Amy Jenkins, 2784.
Alrighty, Amy Jenkins. My name's Hobbs. If you didn't catch that, I'm your student nurse helping you out today. Do you mind if I check your wristband?
Go for it.
Amy Jenkins, 1984. Alrighty, Amy. Do you know what we're doing here today?
No.
Alright, from what I understand, you have kidney stones.
I do.
They're probably pretty painful, aren't they?
Mm-hmm.
Can you give me a number between 1 and 10, 10 being worst?
9.
9? Okay. Well, luckily that doc prescribed some morphine for you. Have you had that before?
I have.
Alright, awesome. Before we get started today, do you have any allergies to anything?
I do not.
Okay. Do you have any allergies to the medication?
No.
Okay. Alright. Any reactions last time they gave it to you?
I did not. It just made me sleepy.
Alright, I was going to say, it's going to make you really sleepy, maybe a little bit lightheaded. It's going to hopefully take that pain down and might give you a headache, but I'm not really expecting that today. Do you still want the medication?
I do.
Okay, alright, and then it might also decrease your respiratory rate. So I'm going to be assessing that throughout the whole duration. You're in good hands. You're with student nurse Hobbs. If you need to get up for any reason, just use your call light. Your job is to relax today, okay?
All right.
Okay, you promise me?
I promise.
Okay, Amy. Alright, I'm going to go get the medications ready, and I'll be right back.
All right.
Shoots. In my med room. This is the med room. Alright. So we're looking for Amy Jenkins. Physician's order says Amy Jenkins 1970 or 84. The date today is 4th. Okay. I'm sorry, the 25th, and scheduled for 16:30. It's 16:30. I'm gonna compare it to my MAR. Amy Jenkins, 1984. No known allergies, and we have morphine, 2 milligrams every 4 hours is needed, intravenous. Alright, location and all that, and the date today is for the 26th, okay? That's weird. The MAR says the 26th, and the physician's order says the 25th. Correction, I don't know what that is, but I'm so vigilant that I caught that. My patient is in good hands. Okay, IV Amy Jenkins at 16:30. All right. Okay, so according to my diagnostic and medication book, we would dilute this with 5 milliliters. And if I pull out my medication, here's the medication. Morphine 2 milligrams per milliliter, so we're going to push 1 milliliter, dilute it with 5 milliliters of normal saline. I'm going to do some hand hygiene before I get started. Okay. clean this for 30 seconds. Seconds, discard new alcohol pad. Clean my morphine. Oh, I like this sign. Sharp safety begins with you. It's pretty cool. Alright, that's 30 seconds, discard. While that's drying, I'm gonna pull out what I need. I need a 10 milliliter of 0.9% sodium chloride. And I'm gonna need my safety needle.
It's already opened.
Oh, it's already opened. That's nice. Okay. Okay, so I'm going to drop 6 milliliters of air. Confirm with my nurse, even though it's just air. Confirm.
Carving it. Yep.
I'm gonna put 1 milliliter of air into my morphine. This is just to create a good vacuum. And then the other 5 into my normal saline. And I'm gonna draw up 5 milliliters. Confirm with my nurse.
Yep.
Okay, next I'm gonna draw up the last 1 milliliter of morphine. It would be good nursing practice though to switch needles. And the last milliliter, and you gotta be careful here because you don't want to push it back in. And that's 6 milliliters, confirming with my nurse.
Mm-hmm.
All right. Safety that. Actually, don't safety that. Excuse me. Okay, now that I have my medication, I'm gonna go ahead and label it. Morphine, 2 milligrams IV at 16:30 on the 25th. 16:30. Okay, with my MAR. I'm gonna go ahead and take my gloves off to use the MAR. Discard pile. Put my medication away. Keep these for later use. No, we already got some. Discard. Okay. Trash. Discard. Okay. Morphine, 2 milligrams, IV 1630. MAR says for Amy Jenkins, 2/7/1984, 1630, morphine sulfate, 2 milligrams, IV 1630, intravenous. And my physician's orders, Amy Jenkins, 2/7/1984, morphine 1630 on the 25th, IV 2 milligrams every 4 hours as needed. Okay. Sweet. So that was our second check. I have my stuff labeled. I'm gonna go ahead and take this back to my room. Hi Amy, it's Hobbs, I'm back.
Hi.
Can I come in?
Yep.
Alright. How are you doing?
Good.
Good. Can you just tell me your name and date of birth?
Amy Jenkins, 2/7/84.
Can I check your wristband?
Yep.
Amy Jenkins, 2/7/1984. Alright, awesome. And then I'm going to check my imaginary MAR that should be in the patient's room for morphine sulfate, 2 milligrams, IV 1630 on the 25th at 1630. Okay. Alright. So now that I'm here, I'm gonna get everything ready. I'm just gonna lift you up, okay, Amy? I'm gonna hang out with you for a sec.
All right.
Patient's already in semi-Fowler's position. I'm gonna check her respiratory rate. So, Amy, what's your granddaughter's name? Tell me about yourself.
Patty and I'm in here.
Okay, actually, correction, I wouldn't want them to talk while I'm checking respiratory rate. So I would just say I'm like checking pulse or something, is what I think Amy told us. And then you would hold this. Okay, respiratory rates are good. How's that pain level?
9.
9 still?
Mhm.
It's alright, Amy. And you don't have any allergies, that's correct, yeah?
That's correct.
Alright, and just so you know, you're gonna feel really tired after I give this to you, okay?
All
I don't
right.
want you walking around or anything like that. Just use your call light. Your job is to cruise today.
Okay.
Okay. Correction, I would expose the arm before I put gloves on. Okay, so first I'm going to check the IV site. There's no fluid backed up in the tissues, no intravasation. Okay, IV looks good. Alright. Any pain when I'm touching right here?
No.
Okay. Oh my goodness. Just so you know, Amy, Lisa, I was holding this, not touching not wiggling it all over their arm.
IV is having difficulties because arm is full of fluid.
I would clean this for 30 seconds. Tony's here?
Mm-hmm.
The security guard?
Mm-hmm.
Okay, Lisa, we're gonna keep videoing, but the security guard might try to kick us out. Oh my goodness, he left. He's still there? Okay, it's been 30 seconds. Keeping my IV up in the air. I would first flush with saline. I really hope that security guard doesn't kick us out right now. Okay. I'm gonna flush with 5 milliliters. After I unkink. You're gonna feel a little bit of coldness, okay?
Alright.
It's 8 milliliters. 7, 6, and 5 milliliters. Okay. I'm gonna kink this. Correction, Amy, I'm sorry, not Amy. I keep talking to Lisa. I would put the cap facing up, not down like I did, to keep this part clean. So the cap would stay up. Okay. Clean for 30 seconds. Is the security guard still there?
I don't know.
After I push that 5 milliliters of saline, I would check for intravasation on the arm. Alright, it's all good. Okay, it's been 30 seconds. Okay, Amy, you're gonna start feeling some good medicine here, okay?
Alright.
So on the 30-second mark. Correction, Lisa, I would unclamp it before we started pushing. Okay, so we're at 5 milliliters. Now we're gonna go to, it's been 1 minute, we're gonna go down to 4. This is our second minute. He's out there, isn't he? And it's coming up on minute 3, so I'm gonna push another milliliter. Very slowly. Okay. During this whole process, I will look for any redness around the IV site. And in between minutes, I would actually assess her respiratory rate. She was at an 18 earlier, now she's at a 16. He's out there, isn't he?
I don't know.
Sorry, Lisa, we're concerned about the security guard that always kicks us out. And we're coming up on minute 4. Here in about 10 seconds. 5 seconds, I'm going to push another milliliter slowly. Correction, huge correction. I wouldn't put my thumb on the trigger. You told us that in class, Lisa. Thumb is off the trigger. That's a big correction. Okay, we're coming up on minute 5. And push. Up to 1 milliliter. Alright, Amy, in about a minute, all of it's going to be in you. It should only take like now for it to kick in. Do you feel any pain relief?
Mm-hmm.
Any headache?
Nope.
Just be sure to take some not deep breaths, but just be sure to keep taking some good breaths for me. You can go to sleep if you want to. Is he out there? Lisa, we're gonna get yelled at after this video. Alright, and pushing the last milliliter of saline. Not saline, morphine. Okay, I would clamp. Come on, Ivy. Okay. Discard. This is clean because I have the cap on it. I'm gonna clean for 30 seconds. Just don't look at him.
He's not out there. He looked away. But probably not far.
I might clean this for a minute to make Grumpy Tony wait a little bit longer. No, I'm joking. Okay. Keeping this in the air. Now we don't care where that cap goes because we're not using it again after this. I would let it dry. And the last 5 milliliters of saline. So from 5 to 4. Correction, I would unclamp. Holy crap, Hobbs. Okay. Just a little bit of cold flushing, alright?
Mm-hmm.
another milliliter. It's been a minute. We're coming up on another minute. It's been another minute. Push another milliliter. Can you see the numbers okay?
Mm-hmm. Not right there, right there.
And another minute. Tell me how you're doing, Amy.
I'm doing great. Thank you.
Oh, how's the pain level?
It's going down. It's at a 6.
Only a 6?
Yeah, it'll go down in a bit though, I'm pretty sure.
Alright, hopefully when I'm done flushing the rest of this medicine out the tube, you'll be good to go.
Awesome.
Can you tell me again what you're not supposed to do?
Get up without using my cold light, cause I can fall.
Alright, you're my star patient, Amy Jenkins.
Mm-hmm. I want that other nurse back though after this.
Which nurse?
I don't know what her name is,
Oh.
but she reminds me of my granddaughter.
I think you're talking about Kiwi.
Yeah, that girl's one tough cookie, man.
Alright, so I would close the clamp. Alright. I would put this back, ensuring that there's no kinks. Okay. And then I would make sure there's no fluid. I already did this like 2 times earlier, but I'm gonna double check. Check her respirations. For 30 seconds. Okay, respirations went down from 18 to 14, so I can document that and tell the physician the medication should be working. Can you tell me about your pain level now, Amy?
Yeah, out of 6.
Alright, awesome. And then actually, before I take my gloves off, I keep my gloves on, dispose of everything. This would go in the sharps container. This would go in the trash. Dispose. All right, I'm gonna put you down here, Amy. Okay.
All right.
All right, and then here's your call light. Okay.
Perfect. Thank you.
And then, you feeling okay?
Yep.
Okay. Is it cool if I look at your arm one more time?
Yep.
All right. No redness. Does this hurt to palpate at all?
No.
All right. Awesome. Okay. Respiration's been down. Any headache?
No.
Okay. Awesome. All righty. Well, then you are all set, Amy.
Awesome.
I will be back in about 15 minutes, double check on you, and then again in 30, make sure everything's going smoothly. And remember, what do you do if you need something?
Use my call light.
Awesome, alrighty. Okay, Amy, I'll see you soon.
All right.
I'm gonna go to my med room. And I would document that she received 2 milligrams of morphine at 16:30, diluted with a total of 10 milliliters of normal saline to go into her input if we're recording that. And I would document that it went into the right arm IV. IV looks good, no intravasation. And patient's respiratory rate went from 18 to 14. Pain rating went from, and I would log out of my MAR, go back to the patient's room. How's your pain rating?
6.
Still a 6?
Yep.
Alright, at least we're getting somewhere. So I come back in here, pain rating from 9 to a 6. Get my initials, log out of the MAR. And then I would check back with her 15 minutes and then 30 minutes, just because it's a high substance medication, or highly controlled substance. Yes, sir.